Have you ever seen a tick on your dog or cat? Well, you are not alone. Most people have seen one or more of these disgusting little creatures on their dog. I'm Dr. Charlotte Sir with Morgan Animal Hospital. Tick numbers have dramatically increased over the last decade, and there is no end in sight. The vast majority of ticks found in the Niagara area are the American dog tick, which will attach to your dog or cat and suck blood until they are engorged and then fall off. Fortunately, these ticks do not spread Lyme disease to your pet. There has also been a dramatic rise in the number of deer ticks seen, also known as the Exodia tick. This tick carries Lyme disease, which is what we are discussing today. Ticks start to become active once the outside temperature reaches 4 degrees Celsius. The most common areas to find ticks are in fields or wooded areas with tall grass or brush. However, we frequently also find ticks on dogs that have just went for a walk around the neighborhood. These ticks typically feed on mice and deer, however they are not picky and will jump on and attach to other mammals such as cats, dogs, horses, and people. Lyme disease is caused by the bacterium called Borrelia burgdorferi, and it is carried within the gut of the deer tick. When the tick attaches to the skin to feed, after about 48 to 72 hours of attachment, the bacteria is injected with the saliva. Then it multiplies through the skin and spreads. Your pet's immune system will respond to the bacteria and produce antibodies to fight it. However, sometimes these complexes get caught up in the joints, kidneys, or central nervous system. 95% of dogs will never show any clinical signs of carrying the Lyme bacteria, and the immune system fights it off. The other 5% most commonly show signs of Lyme arthritis and can show signs of stiffness, decreased appetite, fever, or warm, swollen, and painful joints. Rarely, the infection can also damage the kidneys, which can manifest as kidney failure. With a simple blood test called a 4DX test, we can detect any exposure to a deer tick that was carrying the Lyme disease bacteria. This test can also detect exposure to heartworm-carrying mosquitoes and 2 other rarer tick-borne diseases called anaplasmosis and Ehrlichia. Annual blood testing is recommended since the test only detects exposure 2 to 5 months after the tick bite. If we find your dog positive for Lyme disease with this screening test, we will perform a follow-up blood test called a QuantC6. This test measures the level of immune response within your pet's body and can let us know if the infection is active or dormant. A vaccine is available for high-risk dogs, which is highly effective at blocking the bacteria from injection and traps it in the gut of the tick while feeding. It is almost impossible to prevent a tick from jumping onto your animal. However, there are a variety of other products available that can help kill the tick within the first 24 to 48 hours of attachment to help prevent the passage of the Lyme bacteria. Some are more effective than others. Please feel free to give us a call to determine which parasite protection is best for your dog's environment and activity level. Daily tick checks are recommended as well, and there are a variety of techniques to remove attached ticks on your dog or cat. We carry tick twisters that are designed to remove ticks with ease. Simple tweezers are also effective. However, you want to grasp the tick as close to the skin as possible and pull directly up to reduce the chance of tearing off the body and leaving the head of the tick attached. If your pet unfortunately becomes affected by Lyme disease, prompt treatment can prevent irreversible damage. An antibiotic called doxycycline is used twice a day for 1 month. It is highly effective in eliminating the bacteria within the body. We perform a follow-up QuantC6 test afterwards to make sure the levels are back to normal. Once treated, recurrence of clinical signs is extremely rare. Unfortunately, ticks are now a part of the pet ownership experience, and we want you to enjoy the time outdoors with your dog. We hope this video has made you more knowledgeable about Lyme disease and ticks. If you have any questions or concerns, please don't hesitate to give us a call here at Morgan Animal Hospital.